Good evening, everyone. My name is Anna Markarova. I'm the public health nurse for the Maplewood Health Department. The Maplewood Health Department partnered up with the Partnership for Maternal and Child Health of Northern New Jersey to give you this presentation today about what parents and everyone should know about HPV, the human papillomavirus, and the vaccine. So just to give you some brief introductions, here we have Yorini Syme is the new Public Health Programs Coordinator with the Partnership for Maternal and Child Health of Northern New Jersey. She is also a consultant within the Maternity Hospital Quality Improvement Network at the New York City Department of Health and Mental Hygiene, and graduated in May of 2020 with a Master's of Public Health at the Mailman School of Public Health at Columbia University. Her area of expertise includes maternal and child health and sexual and reproductive health. Thankfully, for Yorini, we were able to have this presentation for you guys tonight. So thank you for that. And then with us today, we have Dr. Gara Summers. She is a board certified gynecologic oncologist who has over 20 years of experience in diagnosing and managing gynecologic cancer. Dr. Summers' clinical areas of expertise include the treatment of cervical cancer, malignant neoplasm of female genitourinary organs, ovarian cancer, and uterine cancer. And with that, I present to you Partnership for Maternal and Child Health. Thank you.
Thank you so much, Anna. I really appreciate that introduction. I'm going to go ahead and begin. So as she mentioned, my name is Yorini, and today I will be presenting to you what parents and everyone should know about the HPV vaccine. And so before we begin, please close any other browsers that you may have open in your background so as to not interfere with the presentation slides. Also, please make sure to mute yourselves as well. I can mute you in the case that you may have some trouble muting, but I want to thank everyone in advance for joining us today. And just so you all know, this presentation will be recorded. Have your notepads in hand in case you have any questions. At the end of today's presentation, there will be a segment allotted for question and answer where you can ask as many and all questions as you may have about the information presented today. You can also feel free to drop them in the chat. However, I will not pause to answer them until the Q&A section, but it does give Dr. Summers and myself the opportunity to read them and to answer them during the question and answer segment, and so that you don't forget them, because I know that a lot of the times when I don't ask my question immediately, I tend to forget them, so I know I'm not the only one. So yes, feel free to drop them in the chat. Next slide. So today, our objectives are that we will review what HPV is, how it is transmitted. We will talk about the HPV vaccine, reasons why parents aren't vaccinating their children, and why it is important for parents to vaccinate their children, where to immunize, as well as other programs that we have going on that we want to inform you about. So let's talk HPV. I'm sure a lot of parents have probably heard of HPV through different means such as billboards, commercials, friends, family, your family doctor, maybe your children's doctor through discussions about recommended vaccines. First and foremost, HPV stands for human papillomavirus, and it is the most common sexually transmitted infection. 90% of the population will be exposed to HPV at some point in their lives. So that is, quite surprising, but it's actually true. It is transmitted through any kind of sexual contact or any kind of unprotected sex. So this includes vaginal, oral, or anal. And this, if your adolescent or any adolescent for that matter is having any type of sexual contact, meaning that it does not have to be penetrative sex, but any kind of contact without a condom can definitely increase the risk of contracting HPV. So as you can see on this slide, approximately 79 million people in the US are currently infected with HPV. About 14 million people, including teens, become infected with HPV each year. Most sexually active teens and adults may spend years with HPV in their system and not even know. I will discuss this further in the next few slides. According to the CDC, there were about 43 million HPV infections in 2018. Many among people in their late teens and early 20s, since HPV is the most common in that age group. Most people, about 9 out of 10, will clear the infection from their bodies in about 2 years. However, most HPV symptoms cause no symptoms and will go away on their own. But some types can cause cancer, and I will detail that after this upcoming poll. So again, as you can see on this slide, there are strains that cause most of about 70% of oropharyngeal cancers in the US, which affect about 12,000 people a year. And so when you are infected with HPV, you don't see the symptoms, and cancer can often take years to develop after a person gets HPV. So I'm going to go ahead and ask you guys a poll question. So first and foremost, HPV causes cervical, vaginal, vulvar, and oropharyngeal cancer in women. True or false? Now let me pull up the question so it gives you an opportunity to ask it, answer it. You should see it on your screen now. Take a few seconds to fill it out. Okay, most folks have answered. I'm going to give it a few more seconds. Okay, I want to say that's everything, and I'm going to end the poll. And everyone, I hope you can see the poll results here, answered true. However, I want to tell you guys that this is actually false. And there's a specific piece of information in here that is what makes it false. So while HPV does cause cervical, vaginal, vulvar, and oropharyngeal, it does not, well, it's actually true. I apologize. It is true. So one thing that I do is that I ask my students, does it cause breast cancer? And a lot of them agree that it does cause breast cancer, but actually it does not. So it causes all of these things. It causes cervical, vaginal, vulvar, and oropharyngeal cancer in women. So you guys all answered correctly. And in men, I just want to add that it does also cause penile, anal, throat, and mouth or oropharyngeal cancer. So I'm going to continue to the following slide. Thank you all for answering the poll question and participating. So most common cancer in women is cervical, but apart from cervical, HPV can also cause vaginal, vulvar, anal, and oropharyngeal cancer. The most common cancer in men is oropharyngeal, but apart from that, HPV can also cause penile and anal cancer, as I mentioned in the previous slide. There are thousands of strains of HPV, and some cause cancers and other can cause genital warts. So genital warts can be found in both men and women. The thing with genital warts is that it's not cancer, so it wouldn't be considered as severe, but it is treatable. Genital warts are not life-threatening, but it's usually visually unappealing and a little bit uncomfortable. They can cause emotional stress, and their treatment can also be pretty uncomfortable as well. And about 1% of sexually active adults in the US have visible genital warts at any point in time. Now, if a person is exposed to a strain that causes cancer and gets cancer, then unfortunately, they will have to go through different treatments that are entirely distinct from genital warts. In addition, HPV is different from other sexually transmitted infections in the fact that there are no signs or symptoms, which is something that I had previously mentioned. So whereas other sexually transmitted infections, sometimes you see symptoms of irritation, abnormal discharge, foul odor, discomfort in urinating, burning, itchiness, so on and so forth. With HPV, there are no signs or symptoms. So unfortunately, if an adolescent contracts HPV, for example, at the age of 17, usually they can go years and years without even knowing it, and probably won't find out until they get a diagnosis, perhaps in their late 20s or in their late 30s, or if they get an abnormal pap smear. So that's usually when a person finds out that they have HPV. Now, in the following slides, we will discuss how you can prevent it in your teens, in your adolescents and teenagers, and what to do if they are already sexually active. So is there a cure for HPV? Unfortunately, to this point, there is no cure for HPV. One thing that I would like to talk with parents, though, is on being able to recognize and know the symptoms and know the risk factors for what increases your chances of your teens contracting HPV. One of those is lack of knowledge. So the less educated a child is, the more likely they are to engage in unprotected sex with many partners. Taking protective measures like using female and male condoms decreases the likelihood of getting HPV or any STI for that matter. We know that adolescents get curious, they start experimenting, so making sure that they are educated and well protected is very important and a very crucial first step. Another is the reducing number of sexual partners. So, of course, I'm sure we are all aware that the more sexual partners, the higher probability of contracting HPV. However, the best step that one can take in protecting one's own health and that of their adolescent is getting vaccinated. So as you can see on this slide, there is a vaccine that prevents HPV-related cancers, and it is over 90% effective. So as you can see here, the vaccine itself came out in around 2006, and we're in 2022 now. Happy New Year, everyone. So that makes it about 16 years on the market. The HPV vaccine is made using a protein from the surface of the HPV virus. It does not contain any genetic material, so it cannot replicate and cause an infection. It is inactive against previously acquired HPV types. So optimal vaccine efficacy is derived if the vaccine series is received before the onset of any type of sexual activity. So I will get a little bit more into that in the following slides. Antibody responses are highest at the ages of 9 to 15. And as I mentioned, I will get a little bit more into that in the next slide. Current data suggests that the vaccine protection lasts for at least 8 years without any waning immunity. So you can see how powerful this vaccine is, that you don't even need a booster. The best way to remember to get your child all of the shots that they need is to make an appointment for the remaining shots before you leave the doctor's office. So that is a recommendation. So again, take a look at this chart. There are thousands of HPV strains. Here on this chart, you see that the HPV vaccine types are labeled as bivalent, quadrivalent, and 9-valent. Valent is pretty much just a fancy name for saying that it offers protection for 2, 4, or 9 strains of HPV. There are 2 types of HPV vaccines. So there is Gardasil and Cervarix. And I'm going to finish up my slide. And I don't know if Dr. Guerra, you are the expert in the HPV vaccine. So if, feel free to hop in whenever you feel the need to. But the Gardasil quadrivalent protects against 4 types of HPV. And then Gardasil 9 protects against any additional 5 types. So while Cervarix protects against 2 types and the 2 most common strains, all vaccines protect against the 2 strains of HPV that most commonly cause cervical cancer. However, only Gardasil and Gardasil 9 protect against 2 types of cancer of the 2 types of HPV strains, that most commonly cause genital warts.
Really?
Yes.
Just to add, and what was found not too long ago was that if you immunize kids prior to age 15, it's a 2-dose schedule. Reason being for everybody is that the younger we are, the more robust our immune system is. But once anyone is 15 and older, then we go to a 3-vaccine schedule. And the vaccine is approved up until age 45.
Correct. Thank you so much, Dr. Summers. And I will also get into more of that as well. So just to finish up with this chart here, the U.S. Food and Drug Administration approved Gardasil, a vaccine for 4 types, again in 2006, which I mentioned, and the FDA approved the other vaccine, Cervarix, which protects against the 2 high-risk types of HPV in 2009. The 9-valent one, or Gardasil 9, was approved in 2014, and since late 2016, only Gardasil 9 is distributed in the United States. So this vaccine protects against the 9 types, as you can see here, 6, 11, 16, 18, 31, 33, 45, 52, and 58, which are the ones that are the ones that cause most cervical cancers and genital warts. So this is exactly what Dr. Summers was mentioning in the previous slide about what the recommended dosage is and how frequently. So as she mentioned, in June of 2019, the CDC recommended that to get the vaccine between the ages of 9 to 26. They also recommended that 11 to 12-year-olds receive 2 doses of HPV vaccine 6 to 12 months apart. The first dose is routinely recommended at ages 11 through 12 years old, but it can be started at the age of 9. So as early as 9 years old, you can get your child vaccinated for the first dose. And then only 2 doses are needed if the first dose was given before the 15th birthday. So if that is confusing, we can discuss more about that in the Q&A. But in addition, in October of 2018, the U.S. Food and Drug Administration announced that it had expanded the approved age for the HPV vaccine up to 45, as Dr. Summers mentioned, for both men and women. However, the older that you wait to get the vaccine, the less effective it is. And the reason for that is when you're older, you're already more likely to be sexually active, right? And so it is most effective before onsetting sexual activity. And so that's why when you're younger, before the age of 15, you only need 2. And when you're older than the age of 15, you need 3. Also, a big recommendation as to why children should get the vaccine at a younger age is because the younger you are, the more likely your insurance is also able to cover the vaccine. And when you're older, insurance is not as likely, and it can cost you about $300. So might as well take advantage of it while it's available for free, while your child is younger. So as mentioned, and as covered, vaccine covers the strains that cause cancer and genital warts. That also means if you're having unprotected sex with someone and you have your vaccines, you're protected against the strains that cause cancer. I hope that this information is clear to everyone. We can definitely have a bit more of a longer discussion during the Q&A if any of this confused any participants. But with that, I am going to open up the next poll, and it asks, if your child got their first vaccine at 14 and their second at 15, will they need another vaccine? About half of participants have already responded. Thank you. I'm going to give it a few more seconds. Okay, great. I think I'll leave it there, and I'm going to end the poll. And I'm going to share your results with you all. I hope you can see it on your screen. So about a couple of you answered yes, and most of you answered no. The correct answer is no. So remember that if your child has received their first vaccine before their 15th birthday, they will only need another vaccine. They will not need the third one, if that makes sense. So it depends on the age that you get the first one. As long as you get the first dose before 15, then you only need 2. If you got your first vaccine at 15, at the age of 15 or later, you will need 3 doses. And I'm going to stop sharing now and close off this poll. Thank you once more, everyone, for participating. So moving on to the following slide, I want to talk a little bit about the reasons why parents choose not to vaccinate. So first and foremost, lack of knowledge. So if you don't know about something, you're less willing to get it, right? It makes perfect sense. If you're unaware, if you haven't gotten the right resources or the right information, you're not going to be willing to put your child to get a vaccine that you don't know what it's about and you don't know why, and it's also, not recommended or not needed, right? Because they go to school and unfortunately it's still not one of the required vaccines, but that doesn't take away from its importance and its necessity, right? So there are some safety concerns of the vaccine and our side effects, which we will go into in the next slide, in the next couple of slides. And also the main reason that parents say, well, my kid is not sexually active. I shouldn't have to vaccinate my kid because they aren't sexually active and they probably won't be for the next few years, right? And that's entirely understandable. However, how likely is it that your child will not be sexually active when they turn 25 or when in their 20s, right? So we have to protect them before they reach an adult age so that they can be the most protected as possible, right? So we have to realize that although our children now are not being sexually active and we hope to prolong that for as long as possible, but we also have to realize that teens, they get to an age where they spend more time with friends and, they are starting to have sexual contact and intimacy with other partners, and you want them to be protected as much as they can. So we are going to get a little bit more into the safety concern or side effects, but I just want to share a little bit of information with all. So some parents don't think boys need to be vaccinated for HPV. And among males, the most common HPV-associated related cancer is oropharyngeal cancer. And so it is increasing for both male and females. And prior, doctors previously thought that the oropharyngeal cancers that were caused by tobacco or alcohol, that's what they thought that it was, now are being identified as HPV-related cancers. So when it was assumed that oropharyngeal cancers were being caused by alcohol and smoking, we now have found out that it's more because of HPV-related infections and cancers. So a report from the CDC shows addressing knowledge gaps among parents, as well as increasing clinicians' HPV vaccination recommendations, are critical to protecting teens against HPV-associated cancers and genital warts. I'm going to move on to the following slide. So we know now that after many years on the market, that it is nearly 100% effective in preventing cervical, vaginal, vulvar, and precancers. Once it is in use, it is monitored for safety and effectiveness. So we are urging you that as early as possible, it's best to vaccinate your child before they are exposed, before they have any type of sexual contact or experience, because then their body would already know that when the time comes and that they are sexually active, that they're protected against the HPV strains that they may be exposed to at any time. So now we're going to talk a little bit more about the concerns of side effects and safety concerns. So, we've all received a vaccine or two where we've had a couple of side effects, right? We've probably got some soreness in the arm, some swelling, maybe some fever. So The HPV vaccine is pretty similar, has mild side effects as well. These do not last long and go away on their own. So as mentioned, these may include pain or redness in the arm where the shot was given, swelling in the area of the upper arm, mild fever, dizziness or fainting. So fainting after any vaccine, including HPV, is more common among adolescents than others, which is why I want to mention that. Headache or fatigue, nausea, muscle or joint pain. So now you may be asking yourself, so my kid isn't vaccinated, how can I get them vaccinated? So there's a federally funded state-operated program called Vaccines for Children that provides pediatric vaccines at no cost to doctors who serve children who might otherwise not be vaccinated because of inability to pay. So the folks who are eligible for the VFC program are any child younger than 19 years of age. They are anyone who is Medicaid eligible, uninsured or underinsured. And so as you can see here, where can I get the vaccine? It can be provided at your local health clinic. So, call up your doctor and ask if they are providing the HPV vaccine, and more than likely they are. The vaccine can be also given at federal qualified health centers or rural health clinics. And again, if you have any questions about getting your child vaccinated, ask your healthcare provider or your child's doctor. There are, before I move on to the next slide, there are over 1,000 medical offices enrolled in New Jersey in the VFC program. So in Jersey, there's a lot of coverage for the VFC programs. And now kind of ending with the HPV portion, I would like to quickly put in a little piece about the Protect Me with 3 campaign. So it is an annual poster and video contest, and it is a collaboration between the Partnership for Maternal and Child Health of Northern New Jersey and the New Jersey Department of Health. So it targeting youth in middle and high schools. The contest aims to raise awareness about the importance of adolescent immunizations among preteens, teenagers, and parents, and increase vaccination rates for several important vaccines, such as COVID, Tdap, human papilloma, meningococcal, and flu. So even though the poster here is quite small and you can't see the details, after the presentation is over, I will send a document in the chat room with resources about the information on the slide, as well as the flyer. That way you can see it in bigger letters and get more details. But just a quick run through, the top 3 posters and videos will win prizes, and they can potentially win some money, and will be showcased at the statewide immunization awareness events. The top 5 finalists for each category will also be posted on our website during the voting period. So make sure that you share this with your high school kids, with your adolescents. Just to follow the steps, you can go ahead and go on the Protect Me with 3 website, download and fill out the high school form and checklist. This is more for students, but they'll check this with you, review the information video before submitting the poster, and then mail the poster and form using the address that's on the website. So registration is open now until January 23. So they have a few more days if they're interested in participating. The early bird ended, but it's not too late for them to still participate. And so I want to just share this with you in case any of you are interested in sharing with your teens. And with that, I would like to end this presentation with a short video. And I'm going to stop sharing my presentation and share my, my YouTube video. 1 second.
Parents should get the vaccine for their children. I'm a mom, as well as a physician and a public health official. And, I live by the words that we at the health department promote. And that is, making sure that you get your child up to date on their vaccinations. My child is vaccinated against HPV cancers, as well as being up to date on other childhood vaccines.
Okay, let me go back to sharing my presentation. And then last but not least, to finish off before our Q&A segment, I would like to leave here my contact information if you have any additional questions. Before the Q&A, I also want to give a little tidbit that we do have a program where we are providing folks with some gift bags and some incentive bags. And so inside the incentive bag, you will receive a water bottle that looks like this one, a stress ball like this, a notebook and a pen like this, a small hand sanitizer, in addition to a couple of pamphlets that talk about COVID, that give information on the HPV vaccine, as well as flu, since we're in flu season. So if you are interested in receiving one of those bags, feel free to email me with your address if you feel comfortable with that, and I can mail a free bag to you. And just want to thank everyone for attending, for participating, for completing the polls. I hope that all the information that I shared today was well received. And if you have any questions, comments, you can share it now during the Q&A, and also contact me via email, via phone. And after this, I will also be emailing folks with a post survey that I would really appreciate if all completed. And with that said, it commences the informational piece, and now moving into the Q&A piece. Thank you all again for participating.
That was great. Thank you, Irene. Thank you.
Thank you.
So if anyone has any questions, you can either raise your hand, you can type it in the chat. If you raise your hand, you can unmute yourself and ask the question. Otherwise, we can put it in the chat.
I'm also trying to share I'm also throwing in the chat right now a document, as I mentioned earlier, that provides resources with information from the PowerPoint, as well as the Protect Me with 3 flyer. So give me 1 second and I will send, and you will receive that now. Let's see, where is it? But yes, also Dr. Summers, if there's anything that I missed that I didn't share, please feel free to take this time as well to share any piece of information that, you think that may be essential for folks to know.
Thank you. I just wanted to spend a couple of minutes discussing the impact of cervical cancer worldwide. Very tragically, a woman will die every 2 minutes from cervical cancer. And if, again, we look worldwide, there are about 500,000 cases reported each year. And cervical cancer is one of the most common malignancies that women face. There are about 250,000 deaths worldwide from cervical cancer. And if we look at the United States, there are about 14,000 new cases every year and about 4,000 deaths. So, all of this is preventable. And it's just also tragic when it's so easy to get vaccinated, get kids vaccinated, young adults vaccinated, and women up to age 45. So I just wanted to throw that in.
There was also the small clip of you, Dr. Summers, that the partnership has, where you also created a a short video for us. I was thinking about sharing that. I don't know if you would mind.
At all.
Okay, great.
What it's about.
I'm going to share again my my YouTube screen so that you can all see which clip I am referring to.
There are 2 women within the past 24 months that have really pulled at my heartstrings, in part because of their age. One patient was 25, the other patient was 31, also in part because they left young children behind. Both of these women died needlessly. If they had received HPV vaccination, these were totally preventable cancers. They were both women who presented with metastatic cervical cancer, and the best I could offer them was palliative treatment.
There it is. So if there's, yes, Liliana?
Yes, I just want to add that, those 2 videos and others, short videos, and actually we have a longer one, they're available on our YouTube page at the partnership, and we'd like to encourage, everyone to share them to their social media, use them as educational tools. They are free, they are available. We are happy to share them with you. And if you have any other suggestions on places where we could do presentations such as this one, or share the presentation is recorded, this is probably going to sit on our YouTube page. Please share the information, tag us in your post and so on, so we can bring the education and the word about the vaccines, to as many people as possible.
Thank you, Liliana. So on the document that I shared in the chat, it also provides a link to the partnership's YouTube page, so they have access to all the videos. I've also shared there the link to the partnership's website, along with other links to the CDC and the Protect Me with 3 flyer. So yes, that is all available to you. And please feel free to ask any questions. This is a time we have Dr. Summers, who is an expert in this information, and we want you to take advantage of having this excellent resource here for you all.
For those, sorry, briefly before we continue, I just put, in addition to some federally qualified health centers, as was said in the presentation, in and around Maplewood, New Jersey, the closest ones would be West Orange, Newark, and Irvington. In addition, I put the link to our township website, which has all of our community resources and other places where you can get low to no cost vaccinations.
Thank you, Anna.
Does anyone have any questions for Dr. Summers, Partnership for Maternal and Child Health, or myself about HPV? Yep.
Hi, this is Emily Haynes. I was wondering, since we have Dr. Summers on, Dr. Summers, could you please explain why it is that, HPV is not really diagnosed in a lot of women until it's already pretty advanced in cervical cancer? Could you explain why don't we find HPV earlier?
Sure. I think it's a matter, like most things, of just having access to quality health care. Whenever we start doing our pap smear screening as part of the cytology, we always do HPV typing as our standard. So we can pick this up before it presents itself as pre-invasive or invasive disease, but you have to get the patient to the office. You know, we wouldn't be doing pap smears on any teens, if you would, in general, any very young women, but we basically start the process around age 21. And again, we do HPV typing on all our paps. Unfortunately, by the time somebody prevents with a visible cervical cancer, I mean, you know it's caused by HPV, but, you know, we're just seeing too much disease and too much advanced stage disease. So like most things in life, the key is early screening. As Irene said, you know, once you have HPV, you have it for life, but HPV doesn't necessarily mean you are going to get cancer. There are many things that can be done in terms of prevention and follow-up so that, you know, that is not the outcome.
Thank you, Dr. Summers.
Thank you. The chat also asked, someone in the chat asked Dr. Summers, can the HPV vaccine be taken with other vaccinations at the same time?
As far as I know, yes. You know, I'm not a pediatrician, and I've done a lot of HPV vaccination, but from my memory, and both of my kids got vaccinated, I'm pretty confident when they got Gardasil, they got something else as well, and you know, there were no issues. So I would say yes, it can be given.
From my understanding, they can also, yes, be given with other vaccinations. And Emily said yes as well. So we have a lot of yeses in the house. Dr. Summers, I actually have a question for you. What is your opinion on the change from the annual pap smear? It went from annual to 3 years. And I think now they're maybe even talking about 5 years. What is your stance on that? HPV. Early onset, like you said.
I think it's fair. These are standards from the American College of Obstetrics and Gynecology and the American Cancer Society, and they're time proven. If you're doing straight cytology, typically it is 3 years. With HPV typing, it can be 5, and then there's some combinations thereof. But again, you're talking about a population that accesses a clinic and or, you know, a gynecologist, nurse practitioner on an annual basis. If, you know, you're talking about a population that really, you know, pays regular healthcare visits, it's a whole nother ball of wax.
You're absolutely correct. That is absolutely correct. Yes. You make a very good point. Does anyone have any other questions for Dr. Summers? We know vaccination is very important, especially in this age. And, you know, in the pandemic, we've been isolated inside, quarantined at home, and a lot of kids have missed their up-to-date vaccinations. So understanding the importance of keeping up with vaccines and the reason why we do it is very crucial to society nowadays. So with that, I thank you guys. I thank Dr. Summers, Partnership for Maternal Child Health, and everyone who came on this presentation tonight. It is a Monday night, but I'm really glad that everyone came out and learned a little bit about HPV and the vaccine. Even I, in my nursing field, know that a lot of people don't know a lot about HPV and the importance of it. So thank you, everyone. Yoreni, do you have anything to say before we end this?
I just want to thank everyone as well for joining me today. Yes, it is a Monday night. It is very cold outside. I hope that everyone is home, safe, warm, and free from any sickness. I hope that everyone is safe. But thank you again all for joining us. And I hope that you learned something here today. And if you didn't, that means that you are very knowledgeable about the information, and that's the best that we can hope for, that everyone becomes as educated as possible when it comes to HPV and the vaccine and to prevent cancer. So thank you all. I hope that you all have a great night. Thank you again, Dr. Summers. Thank you again, Anna from the Maplewood Health Department for collaborating with us. And I want to wish everyone a great night.
Thank you.
Just want to add one last thing. I'm sorry. I don't know if you added, you know, in our presentation, but I want to mention that we get support, funding support for our work on immunization initiatives, including specifically the HPV from New Jersey Department of Health and White Hill Foundation. So we want to thank, you know, those sources of funding for our support. And Dr. Summers, did you want to mention some closing words?
I just think we have to be vigilant. Our vaccination rate in New Jersey is amongst the worst in the country. So we just have to get the knowledge out there, keep reaching the people we need to reach, and so we can accomplish our goal. It's not impossible. It's not impossible.
That's right. Yeah.
Thank you, Dr. Summers. Thank you. All right. Well, have a great night, everyone. Thank you.
Good night.
Good
Good night,
night.
everyone.